What if I told you that one of the most common nutrient deficiencies in America could be affecting your energy, your mood, your muscles, even your immune system, and you might not even know it? If you've been feeling constantly tired, getting sick more often, or simply not feeling like yourself, it's easy to blame stress, aging, or a busy lifestyle. But sometimes your body is trying to tell you something much more specific. Number 5, your cuts and wounds seem to heal more slowly. Think about the last time you got a small cut, scrape, or bruise. Did it seem to take much longer than usual to heal? Most of us don't pay much attention to the body's healing process until it starts slowing down. Healing is surprisingly complex. Your body has to control inflammation, repair damaged tissue, and build healthy new cells. Vitamin D is involved in several of these normal biological processes, which is why researchers continue to study its role in wound healing. A slow healing cut doesn't automatically mean you're deficient. Diabetes, poor circulation, certain medications, and other medical conditions can also delay healing. But if slow healing appears alongside several other warning signs we've discussed today, it becomes another reason to take a closer look at your overall health. Sometimes, it's not one symptom that matters most, it's the pattern. And the next sign is something many people notice in the shower without realizing there could be an underlying reason. Number 4, you're losing more hair than usual. Finding a few hairs on your pillow or in your hairbrush is completely normal. In fact, most people lose between 50 and 100 hairs every day. But what if you're noticing significantly more than usual? What if your hair feels thinner than it did a year ago? Hair loss is complicated. Genetics, hormones, stress, thyroid disorders, nutritional deficiencies, and certain medical conditions can all contribute. Vitamin D helps support the normal function of hair follicles, and some research has found an association between low vitamin D levels and certain types of hair loss. That doesn't mean vitamin D is always the cause, but it may be one factor worth evaluating, especially if hair thinning is occurring together with fatigue, muscle weakness, or bone discomfort. Healthy hair often reflects overall health. Sometimes your hair is giving you clues long before other symptoms become obvious. Now, let's move to another symptom that many people mistakenly blame on getting older. Number 3, your muscles constantly ache. Have your muscles been sore for no clear reason? Maybe you haven't exercised recently, yet your legs, shoulders, or back always seem to hurt. Persistent muscle aches can have many different causes. Overuse, poor posture, dehydration, medications, and autoimmune conditions are just a few possibilities. However, vitamin D deficiency has also been associated with muscle discomfort in some individuals. Some people describe it as a deep, persistent ache that never seems to completely disappear. Others simply feel stiff and uncomfortable throughout the day. Because the symptoms often develop slowly, people adapt to them instead of asking why they're happening. Pain should never simply become your new normal. If ongoing muscle pain is interfering with your quality of life, it's worth discussing with your healthcare provider. Now we're down to the final 2 warning signs, and this next one often surprises people. Number 2, you're sweating more than you normally do. This one isn't as well known. Have you noticed unusual sweating, especially around your forehead, even when you're not exercising or in a hot environment? While excessive sweating has many possible explanations, it has historically been observed in some people with vitamin D deficiency. On its own, this symptom doesn't tell us very much. But when unusual sweating appears together with fatigue, muscle weakness, bone pain, and several of the other symptoms we've covered, it becomes another piece of the puzzle. Your body rarely communicates through just one signal. More often, it gives us several subtle clues that, when viewed together, tell a much bigger story. And that brings us to the number one warning sign. Ironically, it's also the reason so many people never realize they have low vitamin D. Number one, you have no symptoms at all. Yes, you heard that correctly. One of the most important things to understand about vitamin D deficiency is that many people experience no obvious symptoms whatsoever. They go about their daily lives feeling perfectly fine. Meanwhile, their vitamin D levels remain low for months or even years. That's why vitamin D deficiency is so often discovered during routine blood work rather than because someone recognized a specific symptom. Certain groups are more likely to develop low vitamin D levels, including older adults, people with darker skin, individuals who spend very little time outdoors, people living in northern climates, those with obesity, and people with medical conditions that reduce nutrient absorption. If you fall into one of these groups, it's worth asking your healthcare provider whether testing is appropriate, even if you feel completely healthy. So, what should you do if some of today's warning signs sound familiar? First, don't panic. Remember, every symptom we've discussed today can have many different causes. That's exactly why it's important not to jump to conclusions or try to diagnose yourself based on a YouTube video. Instead, think of this video as a starting point for a conversation with your healthcare provider. A simple blood test can measure your vitamin D level and help determine whether supplementation or other lifestyle changes may be appropriate for you. If your levels are low, your healthcare provider can recommend the right treatment plan based on your individual needs. For many people, that may include vitamin D supplements, safe sun exposure, or increasing foods naturally rich in vitamin D, such as fatty fish, egg yolks, and fortified dairy products. The key is choosing the right approach, not simply taking high doses on your own. More isn't always better. In fact, excessive vitamin D supplementation can be harmful, which is why personalized medical advice is so important. The good news is that vitamin D deficiency is often easy to identify and, in many cases, straightforward to treat once it's recognized. That's why paying attention to your body's signals matters. Small symptoms that seem unrelated may actually deserve a closer look when they occur together. Your health is built on the small choices you make every day: getting enough sleep, staying active, eating a balanced diet, and addressing concerns before they become bigger problems. Listening to your body isn't about worrying over every ache or pain. It's about recognizing patterns, asking questions, and making informed decisions with the guidance of a trusted healthcare professional. I hope today's video helped you better understand the warning signs of vitamin D deficiency and gave you practical information you can use to take better care of your health. If you found this video helpful, please give it a thumbs up. It really helps support the channel. And if you're interested in more science-based, easy-to-understand health content designed to help you live a healthier life, be sure to subscribe and turn on notifications so you never miss a new video. Now I'd love to hear from you. Which of these warning signs surprised you the most? Or have you ever discovered you had a vitamin D deficiency through a routine blood test? Share your experience in the comments below. Thank you so much for watching. I'm Dr. Elena Quinn, and I'll see you in the next video. Stay healthy and take care. Vitamin D deficiency affects millions of people, yet many don't realize they have it because the symptoms often develop slowly and can seem unrelated. That's why it's frequently overlooked until it starts affecting everyday life. In today's video, I'll walk you through 10 warning signs of vitamin D deficiency you should never ignore. Some of these symptoms are surprisingly common, while others may catch you completely off guard. And by the end of this video, you'll have a much better understanding of whether it's worth discussing your vitamin D levels with your healthcare provider. Let's get started. Number 10, you're constantly tired. Do you wake up feeling exhausted, even after getting 7 or 8 hours of sleep? If the answer is yes, you're not alone. Persistent fatigue is one of the most frequently reported symptoms among people with low vitamin D levels. Of course, being tired doesn't automatically mean you're deficient. Poor sleep, stress, thyroid disorders, anemia, and many other conditions can also cause fatigue. But vitamin D plays an important role in keeping your muscles, nerves, and immune system functioning properly. When levels are low, your body may not work as efficiently as it should, leaving you feeling drained throughout the day. Many people simply assume they're overworked or getting older, when in reality, there may be an underlying nutritional deficiency contributing to how they feel. If you've been experiencing unexplained fatigue for weeks or months, it's worth having a conversation with your healthcare provider. But tiredness isn't the only clue your body may be giving you. Number 9, you get sick, more often than you used to think about the past year. Have you caught every cold going around? Does it seem like you're always recovering from one illness just in time to catch another? Vitamin D plays an important role in supporting the normal function of your immune system. Researchers have found that maintaining healthy vitamin D levels is associated with proper immune function, although many factors influence how often we become ill. If your immune system doesn't seem as resilient as it used to be, low vitamin D may be one piece of the puzzle. It's important to remember that frequent illness can have many different causes. That's why it's never a good idea to self-diagnose based on one symptom alone. Instead, look at the bigger picture. If several of the warning signs in today's video sound familiar, it may be time to ask your healthcare provider whether testing your vitamin D level makes sense. Now let's talk about a symptom that many people blame on aging. Number 8, your bones ache. More than they used to have your knees, hips, lower back, or legs been bothering you lately. Many people assume that bone pain is simply part of getting older. Sometimes that's true, but sometimes it isn't. Vitamin D helps your body absorb calcium, one of the essential minerals needed to keep your bones strong. Without enough vitamin D, your body can't use calcium as efficiently, which may gradually weaken bone health over time. Some people notice a deep aching sensation in their lower back, hips, pelvis, or legs. Others simply feel that their joints and bones don't feel as strong as they once did. These symptoms develop slowly, which is exactly why they're often ignored. Rather than appearing suddenly, they can become part of everyday life until people no longer question them. But persistent bone discomfort should never be dismissed without understanding its cause. And the next warning sign often appears long before people connect it to vitamin D. Number 7, your mood just doesn't feel the same. Have you been feeling less motivated lately? Maybe you don't enjoy the activities you once loved. Perhaps you've noticed you're more irritable, emotionally drained, or simply not yourself. Mood changes are incredibly common, and they're influenced by many factors, including stress, sleep quality, physical health, and life circumstances. However, researchers have also explored the relationship between vitamin D and brain health. Some studies suggest that low vitamin D levels may be associated with symptoms of depression or low mood in certain individuals, although it's rarely the only factor involved. That doesn't mean vitamin D is a cure for depression. Far from it. Mental health is complex and deserves proper evaluation. But nutritional deficiencies are one of the many pieces healthcare professionals may consider when looking at the overall picture. If you've noticed ongoing mood changes along with several other symptoms we're discussing today, it's another reason to have an open conversation with your healthcare provider. Now we're moving into a symptom that many people don't expect until it starts affecting everyday tasks. Number 6, your muscles feel weaker than they used to. Have you noticed that carrying groceries feels harder? Maybe climbing stairs leaves your legs feeling unusually tired. Or perhaps getting up from a chair requires more effort than it used to. Muscle weakness can happen for many different reasons, but vitamin D is essential for normal muscle function. Healthy muscles rely on many nutrients working together, and vitamin D is one of them. When levels become too low, some people begin noticing subtle changes in strength, balance, and physical performance. Older adults are especially vulnerable because even small reductions in muscle strength can increase the risk of falls and injuries. The important thing is that these changes usually don't happen overnight. They happen gradually. That's why they're so easy to overlook. But the next warning sign is one that surprises even more people because it has nothing to do with energy, muscles, or bones, and yet it may still be connected to vitamin D deficiency.